Hello, everybody. This is Dr. Kondrot, and welcome. I hope you can hear me. I can't see you folks. If you could please click on Start Video. I see
Hi,
someone
Dr.
there.
Kondrot.
Stephen,
Yeah,
hi.
we can hear you.
Can you hear me?
Yes.
And
Yeah.
I see Pablo. Hi, Pablo. And Dinesh, I don't see you yet.
Yeah, I will start my
Good
camera.
afternoon,
Take
everybody.
your time. I just like to see who I'm talking to.
Good afternoon, doctor. How's everything?
Doing well. Thanks for asking. Hope everybody is having a good weekend. And thank you so much for joining. And I hope I can answer all your questions and maybe point you in the right direction to help you solve some of your eye problems.
I just had my
Sure.
machine yesterday.
Okay, there's Dinesh. Hi, Dinesh.
Hi, Doctor.
So what we can do is you can just raise your hand, or if you have a question, or you can, I think there's something you can hit so your hand goes up on the Zoom. You can either raise your hand mechanically or physically. So Pablo, you have a question?
Yes, I just got my machine yesterday, but I don't know yet how to use it or what is the procedure, what to do. I'd like to have a little bit more of info.
Okay, well, this you're at the wrong meeting. This meeting is for prospective patients. When you
I
are,
don't know why they sent me this one because I'm already in the program.
yeah, it was probably done by error, but Chris, once you join the program, Chris meets with you every week on Wednesday at 2:00 Eastern time. And I meet with you twice a month on a special Zoom call.
Yeah, we had the first meeting already, so I was
Well,
shocked
no,
that she sent me
next
that link
Saturday, next Saturday is
at 2:00.
no, it's next Saturday at 2, yeah. But you can also talk to Chris on Wednesday and she'll go over all the information with you.
That means I have to wait until Wednesday to start using the machine because I got it
Yeah.
yesterday. I have
You'd have to wait till
yesterday was
Wednesday because
Friday, Saturday, Sunday, Monday, Tuesday. I have to wait at least 4 or 5 days in order for me to start using the machine.
yeah, unfortunately, this meeting is for prospective patients. We do have set meetings to help you with the machine. Chris should have sent you a link. I'll tell you what, I'll send you the link with all the videos on how to use the machine.
Please,
So
because I don't want to lose all those days where I can be using it already.
Okay, well, email me your email address to info@Healing the Eye, and I'll send you a link to videos on how to use the machine.
I will do so right now. Thank you so much.
Okay, and I'll send it right to you.
All right, thank you. Have a nice one, everybody.
Okay, take care. Okay, Stephen has his hand up. Hi, Stephen.
Can you hear me?
Yep, I hear you fine.
Okay, in regard to the syntonic light therapy, and I spoke with a practitioner in Connecticut, and he said that, or his assistant who actually took the call, said that syntonic is, basically it's for a different constellation of issues. I said, I have some macular issues and cataracts, and she said, well, that's a medical issue, and syntonic does not address that. That's for a totally different class of issues. So I guess my question would be then, why is that part of the program in your program?
Well, it's part of the program because doctors have been using syntonic light for over 100 years. And I disagree strongly with the doctor you talk to because there are many, many studies to show that syntonic light helps with macular degeneration, glaucoma, and cataracts.
Okay.
In fact, if you go to my vision event that I have every year, I usually have a syntonic eye doctor talking about light therapy.
I recall that. Yeah, so I saw that, and that's why I followed up on that. There are not very many practitioners of that in my area. So, in fact, very few, and they're at a great distance. So
Well, did you go to the Syntonic website?
I did, and they had a reference. They had find your doctor in your area. You put in your zip code and whatnot. And
And where do you live? Where do you live?
I live in Midcoast, Maine, and the nearest one, if I have one, there's one practitioner in the Portland area, which is 3 hours away, and then the rest are much further south in New England. And I do spend time in southern New England, so that's an option. But I thought I would start, to see if they, anyway, I called this one doctor, and or the assistant, I should say, who seemed very knowledgeable, basically said that's not, your issues are not something we would address in our office. And so I want to check with you to see how you integrate that with your practice, actually. And you just actually,
well, what we do is I feel that the syntonic light therapy works very well with the microcurrent and the homeopathy. So usually our treatment program is the microcurrent therapy for the eye and also the syntonic light. And the syntonic light does a couple of things. One, it balances the autonomic nervous system. And I'm a firm believer that the body will not heal if the autonomic nervous system is not imbalanced. Also, the syntonic light is actually, I think, a very powerful treatment because there's actually, when you do the syntonic light, your eye is open and there's photons that go in to penetrate your retina, and also photons go in to stimulate hemoglobin. And if you look at the science, it's really interesting. Plants have something called chlorophyll, and light is essential for plants to grow and to thrive. And it's the ultraviolet light. It's the photon that hits the plant, goes into the chlorophyll and stimulates a reaction. Now, if I would show you a chlorophyll molecule and put it next to a hemoglobin molecule, which is from blood, you would say, Dr. Kondrot, those molecules are identical. And they are identical, except for one element. The chlorophyll molecule, which is in plant, has magnesium in the center of this big molecule. Hemoglobin has an iron molecule in the center. They're identical. So when you look at this light through these special glasses, a photon actually goes in and stimulates the hemoglobin molecule and causes a whole energy reaction. So in a way, it's kind of fascinating. We are, in a way, kind of similar to plants. We need those photons and we need light. And they've actually identified the whole mechanism. When a photon hits the hemoglobin, it goes to cytochrome A, it stimulates the electron transport chain and puts energy. So, the light therapy is a very important part of the practice in terms of helping, the eye to regenerate.
Right. So with your microcurrent, then the light therapy is a necessary component of it. It's not a.
Well, I think that the microcurrent is the most valuable.
I see.
There are doctors that only do light therapy and their results are kind of minimal. But I think when you combine the light therapy with the microcurrent, that's when we see the best results. And I did publish a study looking at the combination of microcurrent and light therapy. So what is your problem, Stephen?
My current condition is I have macular edema in the left eye, which is stable. I'm going to see my retina specialist next month. And then I have developing cataracts, which are basically stabilized now. They're not getting much worse, but they're not getting any better. And I'm just at that tipping point, if they got much worse, I would have to have something done, but they're not going there. And I do a lot of, I'm using, you know, and maybe I should run this by you, actually. I don't know if you have time for it, but this is one of the discoveries that have come through the COVID thing and address the protocol to get rid of the spike protein and whatever. But this particular doctor was talking, who was not an eye specialist, however, he's a medical doctor, said that cataract's a result of calcium deposits in the lens, and that is a result of excessive zinc. And it was a very complex, what seemed to me very complex series of reactions in the eye. But the sum of it was that if you wanted to offset this excessive zinc somehow causing calcium to precipitate in the lens, and I hope I'm representing that correctly, but that's roughly what it was. Anyway, his thing was to introduce selenium. And so actually I have been putting selenium drops in my eye along in a
Well,
solution.
number one, calcium does not accumulate when you get a cataract.
Oh, okay.
That's false. The fibers, the collagen fibers of the lens become hardened. And maybe if you would say, oh, they're hardened, they're calcified, but that's wrong. So calcium is not, you know, entering the eye. That's false.
It was, well, okay. Now I recall, and I know that I think about it, it's actually had something to do with hearing, that excessive noise caused an excessive amount of zinc to precipitate out of the system. It's so complex. I'm probably misrepresenting it, but I just thought I would run it by you anyway.
But anyway, I think that, you know, taking selenium is safe as a supplement. You know, selenium is in most, it's an essential mineral, but I don't have any knowledge or experience that it'll reverse cataracts.
Well, anyway, the sum total of it is that I'm kind of keeping these cataracts from getting any worse. But as I say, they're not getting better. So anyway, your question was what do I have going on? Those are the two major things.
Mm-hmm. But anyway, in terms of the cataracts, studies have shown that two things take place when you get a cataract. The ascorbic acid levels decrease in the aqueous humor, which surrounds the lens, and glutathione levels.
Right.
And so I always recommend to my cataract patients, take extra supplemental vitamin C and also glutathione precursors, or take glutathione, but glutathione is poorly absorbed. You can take liposomal or get it IV. But there is an eye drop that I like very much. It's called Oclumed. And Oclumed is a drop that contains ascorbic acid and glutathione precursors. You put it in the eye, and it's one of the few products that I have seen to really help reverse cataracts. It's probably the only eye drop that I've seen to reverse cataracts. Not everybody. But out of all the conditions I treat, cataracts are probably the toughest.
And so you've never experienced any reversal in that area, because some people
never complete reversal, but my goal is to either stop the progression of the cataracts or to reverse them to a point where you get better functioning vision. You know, the analogy is, Dr. Kondrot, can you stop aging? I'd be lying to you if I could say I stop aging.
Right.
You can't stop aging, and cataracts are a part of the aging process. So you have to ask yourself, why are you getting cataracts? Typically, it's nutritional deficiency. You know, as humans and guinea pigs are the only two mammals that cannot make their own vitamin C. And there's a Dr. Levy, I can't think of his first name, who wrote a book on vitamin C. He's a brilliant researcher, and he feels that cataracts, macular degeneration, periodontal disease, heart disease are all due to focal scurvy. In other words, we're taking enough vitamin C in our diet to prevent scurvy, but we're not taking enough to prevent focal scurvy. And cataracts are a form of focal scurvy. When I do mission work in Africa, because they're so nutritionally deficient, I'm seeing 18-year-olds, 19-year-olds with advanced cataracts that are blind, young kids that are totally blind because they're just nutritionally deficient.
Okay.
So
My,
that's
well, what form of vitamin C do you, first of all, when he says focal, you mean the body prevents vitamin C from going to one particular part of the body, therefore causing a
no,
deficiency?
by focal, I mean that you have enough vitamin C. I mean, my goodness, they put vitamin C in Fruit Loop cereal. You have enough vitamin C to prevent scurvy, but you don't have enough to prevent these focal diseases like cataract, macular degeneration, all these things. So
So how much should you be having on a regular basis on a daily basis of vitamin
well,
C?
I usually recommend to my patients to take 3 grams of vitamin C a day.
Okay.
And there's a product, you can get it on Amazon or health food stores called NRC. It's a powdered vitamin. It's made non-GMO. It's a powdered vitamin C. You have to be careful because a lot of vitamin C is made from high fructose corn syrup. And you're actually poisoning your body. A lot of the vitamin C's out there come from China. They're contaminated with lead and mercury and other things.
Wow.
So you really have to be careful.
Well, I mean, straight ascorbic acid is extremely hard on the enamel of your teeth and is on your digestion. I've tried the straight ascorbic acid, and that's just impossible to take in any large dosages. So
well, try the NRC. It's a powder. It's
yeah,
a
I know.
fizzy.
Yeah, but except they sweeten that stuff, this is the other thing.
Well, I mean, what are you going to do? I'm giving you advice. You can make excuses not to do it, but
I'm just going to offer some different. For instance, I use sodium ascorbate. In other words, what is it? Anyway, it takes the acidity out of the vitamin C. So,
well, you can try that, but I recommend 3 grams
okay, well,
a
all right.
day. I mean, look at your diet. I think food is our best medicine, and most of us have problems because of dietary issues. We're taking too much sugar. We have refined wheat. We have gluten products, too much salt. All these things are poison. The old time eye doctors felt that there were 3 causes of cataracts: too much salt, hard water, and sugar.
Why would hard water cause cataracts?
Well, too many minerals.
So there is some mineral deposits in the would sound like it's maybe because when there are mineral deposits coming out of the mineralized water into the eye, but I'm just thinking that might be the reason why they don't want you to have.
Well, the main reason, as I told you, scientific studies have shown that there's a decreased level of ascorbic acid around the lens of the eye and decreased glutathione. That's what the studies have shown. So it makes sense to me. You fight it by taking more ascorbic acid, vitamin C, or taking glutathione or glutathione precursors.
Okay. All right. Fair enough. All right. Thank you.
I mean, it's simple. Now, the thing I like about the Occlumed, you're getting a fairly high dose of ascorbic acid and glutathione precursors as a drop right into your eye. And then when you use the microcurrent acts as a carrier to push that into your eye. So the combination of light therapy, Occlumed, and the microcurrent and the light therapy, all those 3 things can help to slow the process. But I'm being honest with you, out of all the conditions I treat, cataracts are the toughest. They're the toughest to respond out of all the conditions. I'd rather treat glaucoma or wet macular than cataracts because people are impatient. They want to see results, but it takes time. The other thing is studies have shown that elevated lead cause problems with the cataract. So all of my patients get tested for elevated lead or mercury. And if that's there, then we got to treat that. We got to get rid of the lead.
Okay.
And I would say that everybody that I see has elevated lead. I mean, lead is part I mean, we grew up at a time when there was leaded gasoline, leaded paint, leaded pencils. You know, it's in the water now. It's in our food. It's even in vitamins now that you're taking. There was a study done that people take a lot of vitamins have actually a shorter life expectancy now.
Well, about 10 years ago, or maybe 12 years ago, I actually did a whole series of metal detox with intravenous AIV. And I thought mercury was my problem, but as in point of fact, actually lead was way off the charts. But I went through the whole process and got it back down to, to an acceptable level. So maybe it's come back again. I don't know.
Yeah, it might be a good idea to get it tested again to see where you are.
Right. Okay.
Anyway, good luck. But I
Okay.
would try the Oclumet, and also the light therapy can help with the retinal edema that you have.
Okay.
Same thing with the microcurrent. That's something fairly easy that we treat to reduce inflammation, because all the studies have shown that microcurrent will reduce inflammation, the same with the light therapy.
So just one last question. I actually did a homeopathic consultation with you. I don't know if you recall that. And but I need to do the follow-up on that. So I guess I have to call Chris for that, I'm assuming.
Right, yeah, because homeopathy can be magical. I love homeopathy, but it's hard to get the right remedy. Homeopathy cured my asthma, but it took the doctor 3 remedies. I mean, the first remedy didn't do anything. The second remedy may have helped, but the third remedy was like somebody hit a light switch. But we have to give the remedy time. Usually I like to give it a couple of weeks to a month, because sometimes typically we don't see a quick physical change, but it's always nice when there's like a mental, emotional change. Maybe you feel more calmer, more relaxed, more energy, a change in, your whole temperament.
Well, yeah, it's a little hard to judge that right now because we just went through an eclipse, 19 degrees Aries, and I'm in Aries, and it very much affected me. So I'm waiting for that to clear out before I come to a determination how the was working. And on top of that, it's Mercury retrograde, and we got some other stuff going on. So, but that's the end of my questions. You can go on to the next.
Okay.
All right.
Well, thanks for joining the meeting. I think, Dinesh, how are you?
Hi, I'm good. Hello, Dr. Kondrot. Yeah, thank you for giving this opportunity to talk to you. My question, let me ask my question. So basically, this is for my son who is 22 years old, and he was part of a car accident, and he got a TBI injury and spinal cord injury. And since then, he had issues with the vision. So he has a blurry vision, basically. We have seen the doctors, a lot of eye doctors, and they say eyes are good, nerve that goes to the eye is good. Problem is with the occipital lobe because he got a damage in the occipital lobe. So he has a basically brain injury. And I saw your video, YouTube video, and you talked a lot of things about the syntonic light therapy. And I got interested in that one, and that's how I reached out to you. So I just wanted to find out what will be a good program for my son to, get his vision back. He's not able to read right now. He can see the people, he can identify the colors, because vision is blurry. So his vision is like 2400 right now. So what kind of program do you suggest? I mean, I was highly interested in a syntonic program. So if nothing else works for him, syntonic is the one I want to try. So what is your
Yeah,
thought?
there's a lot of syntonic doctors that do work with traumatic brain injury.
Mm-hmm.
And there's a whole series of different wavelengths of light that they use to reduce the swelling, and maybe to help regenerate, to take care of the shock that has happened, with the traumatic brain injury. So you can go to this syntonic website.
Okay.
Google syntonic optometry and find a doctor near you, and they can work with you. Now, my interest would be not only to use the syntonic light, but also to use homeopathy. There's some great homeopathic remedies that are good for traumatic brain injury that have some success in publications of helping people in the past with traumatic brain injury. Also, microcurrent, we have some specific frequencies. So a combination of all 3 of those things, should help.
How does the microcurrent work?
The microcurrent, we're using something called frequency specific. It's a very low level current that has a specific frequency. And what we want to do is we want to match the frequency of the microcurrent to the frequency of the tissue. Now, you may ask yourself, well, how do you determine the frequency of the tissue? Well, the frequency of the tissue depends on the carbon, oxygen, nitrogen bonding. It depends on the density of the tissue, the water concentration. It has a certain frequency, much like you look at a tuning fork. One tuning fork may be a C, another tuning fork will be a D. They look the same, but they vibrate differently. So we put in resonant frequencies into the body that help that particular tissue. Now, research has been done. I'm working with a company called iCell, and they've actually identified certain frequencies that stimulate stem cell rejuvenation, that stimulate anti-aging, frequencies that have been identified to improve circulation, reduce swelling, all these things. So we send in these signals into the body to help make those changes.
Okay.
So it's kind of remarkable. It's very safe, and in many cases it can be very beneficial. The one thing, if have I reviewed his eye records?
So I have sent it to Chris. Whatever record I have sent it to Chris. Only thing I don't have is a visual field test because he cannot do the testing. He cannot see anything in that machine where he can do the visual test because his vision is like.
Did he do visual field tests?
Well, we reached out to the doctors and they said they cannot do the visual field test because the vision is like poor. He cannot see anything like those dots and some very small dots he cannot see. If it's a very big letter, this size big letter he can see.
But even to do like confrontational fields, the doctor will hold his hand, you see it moving here, tell me when you see my hand, that type of thing. Because I would want to know if he has a distinguished field defect.
He doesn't have a field defect. He used to have a field defect on the lower left side before, but I think that has improved a little bit now. So he can see every area. He can identify the fingers. He can identify the people and everything. So that area is fine.
Now, the other thing that you should consider is hyperbaric oxygen.
Yeah, someone suggested that. And the thing is, we don't have a lot of data or someone saying that, oh, this will work versus that. That's why maybe that's next thing to try. But I think
yeah, but I think if you would Google traumatic brain injury, hyperbaric oxygen, there's a lot of studies.
Okay.
Now,
Okay.
One thing is that if you do hyperbaric oxygen, you have to go to a doctor's office and sit in an oxygen chamber.
Okay.
But there's something else called EWOT, exercise with oxygen therapy, EWOT. And, if your son's able to run on a treadmill or an exercise bicycle, you can buy an oxygen generator and have him put a mask on and have him exercise hard. And some people feel that you get the same benefit as hyperbaric oxygen.
Okay. Okay. So that's something I'll look into.
Something that you can probably research.
Right. Okay. So from your perspective, do you have any program for us that we can try with you? I know I have reached out to other doctors, but in syntonic field or homeopathy area, do you have any specific program you can suggest to us?
Well, if you were to join my program, what I would do is I would work on a homeopathic remedy for him.
Okay.
We would prescribe syntonic light therapy, which you could do at home.
Okay.
And then I also will develop a microcurrent protocol that he could use.
Okay.
And these are things that he can do every day.
Okay. And this can be done, everything can be done at home, right? All the programs you're talking about. And in homeopathy, is it like a medication? What is it like?
Well, the homeopathy, we use LM potencies, which is a liquid, and you would take that every day. Homeopathy kind of acts as a stimulant, a catalyst to get the body to heal. And typically in his situation, he had, traumatic brain injury. So there are a whole group of homeopathic remedies that have shown benefit for trauma like that.
So
And sometimes the homeopathic remedy alone can reverse trauma.
okay, good to know that. Okay, so like, if I need to work with
And I
you
think
for
you
the,
could probably Google traumatic brain injury and homeopathy, and I'm willing to bet you'll come across dozens of articles
okay,
that show the effectiveness.
okay. All right, yeah, now definitely I will do that. Because we need to try something. He's just 22, and he got these injuries, and now it's almost been 1 year, and still he has a problem with
Mhm.
his eyes. So he recovered some, and in the beginning he was not seeing anything, and now at least he can see some. The doctor says you don't have problem with eye, retina, everything looks good. Problem is in the interpretation, whether it goes to the brain is not able to interpret. So that's where we need the healing. So any specific program, I know I gave you my long history, but any specific program you can think about will be most effective, we can try those.
Well, the microcurrent, we have a couple of there's one microcurrent program that I use. It's kind of we call it the brain reboot. Whenever your computer doesn't work, it's like everything's fine with the computer. The screen's there, but nothing's working. What do? You reboot the computer. And there's a program for rebooting. It doesn't mean like he goes into a coma or something like that. We just send some signals in to kind of reset the electrical pattern of the brain. And I have some experience with that.
Okay. And I know we're talking about multiple program, but I think syntonic, if you want to start with the syntonic program with you, are you able to help with that?
I usually don't do syntonic alone because I feel that it's not as effective as microcurrent and homeopathy. So if you wanted to do syntonic alone, I would advise you to get in touch with a syntonic doctor. Where do you live?
I'm in Tampa, Florida.
I think there are a couple of good syntonic doctors in Tampa.
Okay.
You may want to go to their website and check.
Okay.
But I think if you really want to get, more predictive and better results, you need to combine homeopathy, microcurrent, and syntonic light. That, in my experience.
Right. But syntonic is something can be done right away. Like, you just need to order the glasses. I mean, again, I've seen your video, like, you look at the
you
bulb.
would have to make an appointment with a syntonic doctor and go
right.
in, and they're going to do a series of tests and then recommend a program.
Yeah. So I met with one of the doctor here. Only thing is they want you to come in the office every day. They don't give it to work at home. That's my another problem, because he has a brain injury and he's in a wheelchair. It's difficult for us to go there every day. So something we can do at home, that's what we are looking for.
Yeah, but most syntonic doctors don't do the home treatment. They want you to come into the office.
Right.
So you're going to be it's unlikely that the doctor is going to give you glasses to treat at home.
Okay. Got it. Okay.
In fact, I used to treat patients that way, in the office. I'd make it mandatory you come into the office for 1 week, every day for 1 week. And then when COVID hit, we began to do more online. And, the results were just as good as people coming into the office.
Right.
But that's why that now, I could just do a homeopathic evaluation with them if you were interested. We could do that.
Yeah. I mean, the thing is this, I haven't got the syntonic glasses actually. Someone just I borrowed from someone who had used earlier, but I don't know which glasses to use. Like, it's alpha omega or alpha mu, alpha theta.
Yeah, you don't want to get into trouble because there's a whole science involved. He needs to be evaluated. We have to look at his pupils. He needs an eye exam. It's not like just a certain color will work.
Okay.
I have some ideas of the colors that'll work, but that would just be guessing.
Okay. And what are those, if you can tell us,
What's that?
If you can tell us, like, what are those colors typically work? I mean, just for my research purposes.
No, I can't give you any information because you're really not a patient. And, medically, legally, I can't give you advice because if you'd have a bad reaction, you would say, well, Dr. Kondrot said to use this.
Okay. Got it.
And it could be a problem. And he needs to be under care because, you don't want him to get worse.
Right.
And the wrong
Okay.
therapy could potentially make him worse. So the main goal would be to start any therapy slowly with him, see how he responds.
Okay. Got it. So to get started with your program is basically just get in touch with Chris and
I
set
would
up a time
first
with you.
need, I would need, his complete eye records.
Okay.
But it sounds like we can't get his visual field, so that may not be necessary. And then after I look at his eye records, I'll give you a report on what I think needs to be done. But
Okay.
just talking to
So
you and listening to history,
right.
I think that we can, I think the program can help him.
Okay. I mean, I have seen all the records that I have from the various doctors, their test report and everything. Only thing I don't have is the visual field report because we could not do the visual field test. But again, it could be part of the report what I have sent. So if you can take a look at it, Chris has everything, and if you can let
When
us
did
know.
when did you send the records?
It's been more than 2 weeks ago. I would say 3 to 4 weeks.
Okay, I haven't received them yet. Maybe Chris was waiting for the visual fields.
Yeah, that's what I told her. Like, this is what I have. Whatever I have, I will send it to you. If you can, discuss with the doctor and suggest the program.
Mm-hmm.
So if you can check with Chris and if you can move forward with something.
And what is your last name?
Last name is Markana, Markana.
Markana, Markana.
Yeah, that's right.
Okay. I'll make a note of this here.
Okay.
And I'll be talking to Chris on Monday.
Okay. Yeah. So based on whatever I submitted, please let me know if you can help with any program you have. I mean, homeopathy sounds like a good program to me. So maybe we can start there. Microcurrent.
Yeah, we could start there, immediately. You
Okay.
ask Chris, you just schedule an appointment and we can do it over the phone.
Right.
But I would need both you and your son there
Sure.
for the Zoom call.
Yeah.
So I can talk to both of you.
That's not a problem. Yeah, we can do that.
Okay, well, thank you for your interest, and I hope I can help your son.
Okay, that'll be great. Thank you. Thank you, Dr. Kondrot.
Okay, thank you. Okay, other questions here? I don't see anybody else. Everybody else has their video blanked. So if you could turn on your video, let me see. I think there's something in the chat here. What is my perspective on contact lenses? Basically, I don't like contact lenses for a couple of reasons. Number one, they are a plastic material, and you may have heard a lot of things that are negative about plastic. I mean, plastic leaches, there's petrochemicals in them, so I don't think they're really healthy for your eye. Also, they decrease the oxygenation of your cornea. So I'm not really big with contact lenses. What is the time frame after making ozone eye drops that they stay effective? Well, ozone has a half-life of 2 hours in saline. So what that means is, let's say you have 10 units of ozone in your saline eye drop. In 2 hours, you'll go from 10 units to 5 units. 2 more hours, it'll go to 2.5 units. 2 more hours, it'll go down to 1 unit. So it keeps on cutting in half every 2 hours. So what I usually advise patients, ozonate the saline early in the morning. It'll last all day, but it's losing its effectiveness. If you can, reozonate them at lunchtime or reozonate them in the evening. And I think if you're able to do that, then you're going to get an effective concentration of ozone that'll help. It's always better too to use a lot of the ozone eye drops immediately after you make the ozonated saline. So once you take that saline out of the bubbler, put maybe 5 or 6 drops in your eye, really load your eye up with that richly ozonated saline. Then later on, maybe use it 1 drop every 2 hours or 1 drop, a couple times a day. But I love the ozone eye drops. I think they're really effective. Now, one thing is the ozone eye drops are great for eye irritation. I don't think they have any effect for macular degeneration. They don't have any effect for cataracts. They may have a minimal effect for glaucoma in reducing the toxicity of your glaucoma medications, but don't think that ozone eye drops are going to cure your cataracts or your macular or your glaucoma. They're great for dry eyes, redness, blepharitis, irritation. If you really want to use ozone to treat macular degeneration or glaucoma, then I would recommend either rectal insufflation with ozone or auricular ozone. And I have 2 YouTube videos on that. You can check those out. Go to my YouTube channel, KondrotYouTube.com, and just type in ozone and you'll come up with those videos. Okay, let's see if there's any other questions here. Everybody's hiding. I can see your name, but I can't see you. So if you have a question, you can raise your hand. I can unmute you. Or what you can do is type something in the chat. The chat is active right now. Why don't I do this? I'm going to do a screen share, okay? And I'm going to show you how you can get a lot of good information on my website. Let's see here, 1 minute. Let me do a screen share. Oh, here we are, screen shares. Okay, I hope you can see my screen here. This is my home webpage, Healing the Eye. Type in healingtheeye.com, and there's a couple of things you need to know. One is right here, you can download my best-selling book free of charge. It's called The 10 Essentials to Save Your Sight. I have a lot of good information that I've learned over the years that can help you reverse vision problems. And that's a free download. Then this part right here, it has new to your sight. You click that. And these are the steps that I have. One is become familiar with my approach. You can read my book, or I also have a 10 Essentials webinar. Then you should find out more about your condition. One on cataracts, glaucoma, dry eyes, floaters, macular problems. So find out more about your condition. In these YouTube videos, I talk about the alternative approaches that I feel can be beneficial to reversing this condition. Next step, you can get a free eye record review. I'd like to take a look at your eye records to see exactly what's going on, to see what is your limiting factor. Because sometimes you go to the eye doctor and he tells you you have cataracts, glaucoma, macular, dry eyes. But by looking at your records, I can find out what is the limiting factor that's causing problems with your vision. Once I identify that, I can give you more advice on what you need to do. Then freeconsult.us, you click that, send the records to me, and I'll review them. And I'll give my record review to Chris, and then she'll call you up and give you that information. I just can't talk to everybody who sends in their free records, but I do look at the records and I jot down my notes and give them to Chris, and she contacts you. Then you may be interested in common therapies that we use in our practice. A very good intro video on microcurrent, one on homeopathy, ozone. I talked about the auricular ozone and the ozone rectal insufflation. We have YouTube videos there. There's one on light therapy. There was a couple of questions on syntonic light, and then another big one on detox and chelation. So this is a great source of information for you to become familiar with. Also, those of you that are more into the scientific aspects, this one here is peer review articles related to my work. And if you click that here, you'll take you to, let's see, take you to scientific studies that have supported the type of therapies that I utilize in my practice. There's a book here that I co-authored. I have a chapter in this book on visual rehabilitation. This is a study on outcomes in my program, which is very good because you can actually look at your particular eye condition and see what the results are, and numerous other articles here. So this is a great place to look. Okay, other questions? So you can go to healingtheeye.com. There's a lot of information there. You can also go to my YouTube channel for more information. Oh, that's okay, Diane. Diane just texted me she can't get her camera or mic working. So if any of you have trouble getting your mic working, you can type your question in the chat. Okay, well, if there's no other questions, I want to thank all of you for joining. I have these meetings once a month for prospective patients or patients who are not part of my program, who are interested in learning more about what they can do. And I'm more than happy to give you advice. When you do join my program, you meet with Chris once a week, and she helps you go over using the microcurrent light therapy, taking the homeopathic remedy, and she's available once a week. We have a special Zoom meeting set up for that. And then I meet with you twice a month. It's the first and third Saturday of a month where all of the patients who are doing the program get together, and good questions. It's a support call. We make refinements because I do want to see all of you that get started in the program to have a positive change in your vision. So this is not a program where you have to wait a year or so. We like you to see some type of change, any type of change, within a couple of weeks to a month. And if we don't see that, that means we got to, make some changes. All right, well, I want to thank, if there's no other questions, I want to thank all of you for joining the meeting. And I look forward to hearing from you and helping you any way I can. So thank you very much for joining. Have a good weekend.